For some people, the symptoms are restless legs or heavy and achy legs. For others, it's visual, spider veins and varicose veins. In the old days, patients would go through vein stripping or just live with it. But thanks to modern technology, in most cases, it can be taken care of in one quick, painless procedure at the office. Please welcome Dr. Syed Raza with Premier Vein and Vascular Center and his patient, Etta Irvin. Good morning. All right, Dr. Raza, a lot of people, when they see those veins and things, in fact, I have a friend who went to a plastic surgeon who said, oh, we can just go ahead and get rid of those little spider veins and all the other things. And her legs still felt heavy. They were still achy. So they got rid of the aesthetic issue, but not what lies beneath, and that's the real problem.
Exactly. So vein disease is a medical problem, not just an aesthetic problem, as you just said. So we need to look at the symptoms what people are having. Heaviness, leg cramping, swelling of the ankles. All those are good signs that there is venous reflux beneath what lies on the skin.
Yeah.
So we have to do an ultrasound scan, diagnose the problem, and then treat it, as you said, with a very simple outpatient procedure.
Yeah. Etta, for you, what symptoms were concerning you?
I was miserable. My feet hurt so bad. I teach dance, and we teach for 2 hours. And after we would get through on a Wednesday night, I could hardly walk. And it took me a couple of days to recover from it.
What did you think it was? A lot of people think, well, is it arthritis? Is it, what did you think it was?
Actually, my first thought was that it was plantar fasciitis because so many dancers get that. But I am careful not to wear the heels, and so that wasn't what it was with me. And when I went to the vein clinic, it was just amazing.
Yeah, what made you put 2 and 2 together to actually go to the vein clinic instead?
Well, I also had issues with the spider veins and the varicose veins, so I thought, well, this is a good place to start, because that runs in my family.
Yeah, all right, and oftentimes it can run in the family, right?
Exactly. So the commonest denominator of the disease is genetics. So you typically would see that your parents have varicose veins, or your grandparents. It can skip a generation. You can have it just de novo by yourself. So the important thing is, to basically get advice as quickly as possible.
Yeah, and then of course other people who may be on their feet all day, or like you, dancing for hours at a time. All right, so we're taking a look at what we're talking about there, and you've seen that, and people have seen that on their legs. So when you go in to get to see what the problem might be, it takes just a couple of minutes for you to figure out whether it really is a vein issue or not, and it's painless.
Exactly. So as soon as we see a patient, the important thing is to decipher through the issues of leg pain. So many people have leg pain these days. So it is important to sort out, is it a vein problem? Is it a problem of the spine? Some nerves are getting compressed.
Muscular?
Is it a vascular problem? Some arterial blockages? So the best thing is to consult the vascular specialist, so they can decipher through the problem and find out if it's a vein problem or not.
Okay, so let's go through the procedure to fix it.
So the procedure is an outpatient procedure, very simple. You can literally drive yourself to the clinic, get it done. You can do it in your lunch break, and drive back and start working after you're done.
Yeah, all right. So what was that procedure like for you?
Well, his office is so efficient, and I have to say that everyone in his office is so kind and were so good to me and really encouraging along the way. Very efficient with their work, and I went in. I was there maybe an hour, and they were able to say, okay, well, this is where your problems are. I went back. He did one leg one day and then one leg the next day with the first procedure. And I went back like a week later, and they did just a little bit of stripping with the varicose veins. And I was totally amazed because the pain, and it was funny because I went initially because of the cosmetic, thinking, okay, it's going to look better.
Our vanity gets in the way, yeah.
Yeah. But then I got this wonderful treat of, it was like the first day I could tell the difference, and it completely took the pain away.
Yeah.
And now I can go teach for 2 hours and dance a little before and a little after, and I'm still good to go.
You walked in the office and you danced out of the office.
I did. I love it.
You talked about getting there as soon as you can, because I know I've seen some people where it's so bad that they have the open, like the ulcers on their legs as well. And again, they think it's a dermatology issue, and it's not a dermatology issue. If you can get that blood flow corrected, then those things can heal. But a lot of people have open wounds on their legs that are not healing, and they don't understand it's because of the veins.
Absolutely. So again, the most important thing in an open wound case, which is a very delayed, scenario, it is important to differentiate: is it because of vein problem or an arterial problem?
Yeah.
Those are the two things which can cause open wounds in your ankles or feet. And again, we can in our clinic do the ultrasound scan, find out if it's an arterial issue or a venous issue.
Yeah.
And we can address both of them.
All right, I just want to point out those were not your legs right there. There's some
No.
other people's legs. Yeah, but your legs look good and they feel good most of all.
That's the big thing, is they feel good.
All right, Premier Vein and Vascular Center has a special offer for Great Day viewers. Receive a free vein consultation when you mention Great Day Houston. To get in on this offer, call 832-321-5355, 832-321-5355, or log on to premiervein.com.